Hey, welcome back, everybody. It's now 8 minutes after 9 o'clock. Prostate cancer, the second most common type of cancer in men. While it sometimes often doesn't require treatment, the more aggressive cases can be treated with CyberKnife. Experts, Oklahoma CyberKnife, can perform non-invasive treatment. Remember that, non-invasive. Dr. Diane Heaton joining us this morning to tell us all about it. Dr. Heaton, thanks for coming in today, ma'am.
Thank you for having me.
It's always good to have you in. And we were talking a few moments ago, and you said, was it 1 in 7 men?
Yes, 1 in 7.
Yeah.
We have 2.9 million men currently that have had a diagnosis of prostate cancer in the United States. And 1 in 7. Most of the time it becomes fairly non-aggressive, but at times it can be a very serious disease. Okay, now we've talked to viewers, you've talked to viewers about CyberKnife and how it works. Right. How does it work specifically when it comes to treating prostate cancer? That's one of our most exciting treatments. We go from a length of 44 treatments, almost 9 weeks of therapy, down to only 5, and we do that in 2 weeks every other day. Makes a huge difference, particularly to men who have to travel a long distance. Okay, now how does that compare, though, to some of the more traditional treatments of prostate cancer? It compares very favorably. We are part of a study, and we're showing right now that, particularly in our low-risk men, they're having 98% biochemical disease-free survival at 2 years, meaning their PSA stayed very low, and 93% for the entire group. Those are incredible numbers. They are. We're very excited. You know, because in dealing with people who are cancer patients, when they hear prostate cancer, I mean, the first thought is, is panic and starting to look for information and wonder, what can we do? What can be done? Yes. And when you hear those kind of numbers, that's just amazing. They're early numbers, so we'll caveat that, but we think this is a very exciting treatment. We now have other groups that are out 10 years. They're showing very similar results. We think it's equivalent and may even be slightly better. Wow. Now, when it comes to side effects, surgery and stuff like that, there are side effects, but you were telling me a few moments ago about some of the side effects, or actually non-existent. There's side effects. You know, our first group of 2,000, the majority are within the first 2 years. We've only had one gentleman who had a little bit of rectal bleeding and no urinary complaints, no incontinence, some slight decline in potency rates, but overall that group is doing extraordinarily well. I find it on the acute side also. My biggest prescription is cranberry juice. Wow. Yeah, to deal with side effects. I started to say, usually when you leave the doctor's office, it's going to pick up the prescriptions or whatever. And yours is just going by the grocery store. Exactly, exactly. Okay. Now, does someone, if they want to come in and have a consultation with you and talk about CyberKnife, does a doctor have to send them to you first, or? No, we are available for second opinions, and we're very much want gentlemen to know all of their different options, and particularly if the travel is going to be a huge burden. Okay, so they just need to call you and set up an appointment, and they can come in and find out more about CyberKnife and how it can help with prostate cancer. Absolutely. Wow, incredible numbers. Thank you very much. Thank you, ma'am. It's always good to see you. Thank you very, very much for coming in. Oklahoma CyberKnife, 6802 South Olympia Avenue, Suite G100. It's 71st Highway 175. The phone number to call, 918-949-6676, and see what CyberKnife can do for you. You can also go to oklahomacyberknife.com as well. Well, Tulsa Casa is